Hi, my name is Michelle and I work for Denton County MHMR. I am a social worker there at our MCOT team, and MCOT stands for Mobile Crisis Outreach Team, which is basically where you can receive services if you are in a crisis related to mental health. So through MCOT, we provide services such as screenings, we have a hotline, we have trained nurses and staff. And the cool thing is that it's open 24/7. So, although our physical office may not be open within that 24/7 time frame, we do have things once our office hours end, such as our 24-hour hotline that you can access if you are in a crisis or an emergency kind of situation. So basically, what I do at the mobile crisis outreach team is I'm in something called a crisis psych triage. And so what that is basically a grant-funded service that provides emergency screenings, and basically with these screenings it helps determine the most least restrictive environment for treatment, so the client can have a better outcome. And so another thing that we do a lot of referrals. So we work with people within the community. We work with individuals or systems such as like law enforcement. We work with doctors. As previously mentioned, we have nurses as well. We have counselors. We work with the schools. My caseload, particularly the people that I work with, it always varies. It really, because it is a time of when it is a time of crisis, you never really know. Some months are higher, some are lower, so it really depends. But with that, you do get people who are younger than 18, and so with that, maybe the best way to see this client is through school, because maybe that's the only consistent thing they have at the moment. And so we do work with a lot of different systems, and so that really helps us just build a good relationship with them, because if we ever need something that we're not really sure about, we can always reach out to these other people. We also educate, we inform people. So in the aspects of like law enforcement, if you were to have a crisis situation and say that you are a schizophrenic person and you're having hallucinations and delusions, and so sometimes we can kind of help intervene, depending if there was a crime committed, obviously, but sometimes we can intervene in the sense of educating precincts, and just providing them with that foundational knowledge of what it is to be a person living with mental health issues, whether if that's minor or severe. And so the better that they are informed, the better they're able to go about the situation in a more ethical way, and really help the person versus causing more anxiety and more stress that this person is experiencing and not really able to express themselves in a manner that may not seem dangerous, for lack of better words. So yes, we do work with a lot of people. I also work with people regardless of insurance, so that's a really good thing. Nowadays, it's really hard to have a good insurance, and by good insurance, I mean something that on the both ends is affordable and that also provides good services, at least basic services. And so it's really cool that we have this program where, regardless of your status of having an insurance or not, we're still able to help you. And so that really provides a more inclusive and just holistic service that can really serve these clients in a ways, and kind of break down these financial barriers that may be something else that they're experiencing on top of their mental health, and just making it a little bit easier for them to help themselves. And so that's something that's really cool. Let's see, another thing that we have, like I mentioned, is our crisis line. So we have two kind of hotlines. We have one for the the deaf, the hearing and impaired. And so that one's really cool because, again, that is that holistic kind of perspective of being able to include everyone, because anybody can have a mental health disability, and so it really affects everybody. So another thing that we do in order to treat these clients, because they are in crisis situations, is as staff, they train us on the difference of crisis and emergency. And so this is a great thing, because whenever we are taught the differences of crisis and emergencies, it's very easy to not get overwhelmed, to work effectively, and just to kind of not get overwhelmed, just because working in a crisis environment, a very high stress environment, like I said, you can have different kinds of clients, whether if it's from more severe to schizophrenia, to having dementia, whatever the case is. It's good to have that training to differentiate the difference between those two, and be able to kind of decide how you're going to work about how to properly provide these services for these people in the most ethical, effective way as possible in these crisis situations. And so we get training on the difference between crisis and emergencies. We also get training on suicide, and I think that is something that I took for granted, just because, whenever we learned about suicide, there was a lot of things I didn't know. One of which, people who are experiencing schizophrenia, they have a higher rate of falling into suicide. And so it really is one of those things that you don't really pay attention to, that once you have these different things that you're encountering, it can really affect just the way you go about life. You may have never asked to have an illness as serious as schizophrenia, and then one day you're having a hallucination or a delusion, and then next thing you know, unfortunately, you've committed suicide unintentionally, or whatever the case is. And so I think that's really good to have that training in just really looking within that biopsychosocial of, we know this is going to happen. What is the best way to prevent these things from happening? Let's get trained. Let's all staff be trained. Let's be able to recognize these signs and just really help these people who are in crisis as best as possible, as fast as possible. And other than that, as far as our assessments, we do, as far as the treatment portion, we do an assessment called an emergency clinical assessment. And so that's something that we do through the crisis hotline. And so they're able to arrange that, because some people don't have the form of transportation, and so we found that it's an easier way to do that. Or if we can just meet that person wherever is best for them. It's tailored to each person's needs. And so that is really helpful, because whenever you have assessments, it really just helps break down what needs to be done in the best way possible, but also to make sure that you're assessing someone correctly, because there's a lot of times where you may not have just one mental health illness. You may have two. I've worked with people in the past who have had they've had Alzheimer's and depression and hallucinations, and just all these different things pile up. And so whenever you do these assessments, it's kind of like a snapshot of saying, okay, what can we attend to first, and then the rest can kind of follow along through the process of treatment. So we do an assessment, and the purpose of this assessment is to determine the risk of self and others, because it is a crisis situation. You may unwillingly affect someone physically. And so it really just helps have these assessments to break down and see who else we can bring to help you better yourself, whether if that's doctors, whether if that's psychiatrists, whether if that's, other social workers. So these assessments really help us. And then once we kind of get that snapshot, then we're able to kind of make referrals to the appropriate people so they can further help that person, moving forward through the process. Anyways, again, my name is Michelle, and I really enjoyed working at Denton MHMR, and so I hope to continue working here for a while, and I look forward to, seeing what client I get to have the wonderful experience of encountering next. Thank you.